American culture is now normalizing the idea that minors can be given hormones to prevent their biological development of their secondary sexual characteristics. Dr. Levine, you have supported both allowing minors to be given hormone blockers to prevent them from going through puberty, as well as surgical destruction of a minor's genitalia. Like surgical mutilation, hormonal interruption of puberty can permanently alter and prevent secondary sexual characteristics. The American College of Pediatricians reports that 80 to 95% of prepubertal children with gender dysphoria will experience resolution by late adolescence if not exposed to medical intervention and social affirmation. Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex?
Well, Senator, thank you for your interest in this question. Transgender medicine is a very complex and nuanced field with robust research and standards of care that have been developed. And if I am fortunate enough to be confirmed as the Assistant Secretary of Health, I will look forward to working with you and your office and coming to your office and discussing the particulars of the standards of care for transgender medicine.
The specific question was about minors. Let's be a little more specific since you evaded the question. Do you support the government intervening to override the parent's consent to give a child puberty blockers, cross-sex hormones, and/or amputation surgery of breasts and genitalia? You have said that you're willing to accelerate the protocols for street kids. I'm alarmed that poor kids with no parents who are homeless and distraught, you would just go through this and allow that to happen to a minor. I would hope that you would have compassion for Kira Bell, who's a 23-year-old girl who was confused with her identity. At 14, she read on the internet about something about transsexual. She thought, well, maybe that's what I am. She ended up getting these puberty blockers, cross-sex hormones. She had her breast amputated. But here's what ultimately she says now. And this is a very insightful decision from someone who made a mistake but was led to believe this was a good thing by the medical community. I made a brash decision as a teenager, as a lot of teenagers do, trying to find confidence and happiness, except now the rest of my life will be negatively affected, she said, adding that the medicalized gender transitioning was a very temporary, superficial fix for a very complex identity issue. What I'm alarmed at is that you're not willing to say absolutely minors shouldn't be making decisions to amputate their breast or to amputate their genitalia. For most of our history, we have believed that minors don't have full rights and the parents need to be involved. So I'm alarmed that you won't say with certainty that minors should not have the ability to make the decision to take hormones that will affect them for the rest of their life. Will you make a more firm decision on whether or not minors should be involved in these decisions?
Senator, transgender medicine is a very complex and nuanced field, and if confirmed to the position of Assistant Secretary of Health, I would certainly be pleased to come to your office and to talk with you and your staff about the standards of care and the complexity of this field.
Let it go into the record that the witness refused to answer the question.
What's up, everybody? Welcome back to Reality Unplugged. You know, I've been kind of taking a break from these videos and dealing with some stuff on my own, but I couldn't not address this. I used to think that abortion was the biggest evil that America could commit, the taking of innocent lives that were not able to make the choice to live or die on their own, but were only sacrificed due to other people's selfishness of wanting to live their own life burden-free. I gotta say, the one thing that you can count on America these days is to never disappoint you in finding new ways to stoop so low. Biden's nominee for the Assistant of Health in America, Dr. Rachel Levine, a pediatrician, I believe, out of Pennsylvania, who is testifying at his confirmation hearings in the Senate, actively dodging answering the question from Senator Rand Paul whether or not it's okay to let a minor, specifically a minor before puberty, make the decision on whether or not they were going to live their life as a male or a female. Going so far as asking the question whether or not Rachel Levine would decide to let a minor opt for surgery, transition, as well as, and I had no idea this even existed, hormonal puberty blockers to keep a young girl who has supposedly decided that when she grows up she wants to be a man from ever going through puberty and developing secondary feminine traits. Or a young man who supposedly exhibits the desire to grow up and be a woman from ever going through puberty and developing secondary masculine traits. I believe the average time a young kid goes through puberty is somewhere between 11 to 12 to 13, depending on early or late bloomers. So the argument is essentially whether or not a 10-year-old should make the decision to have a surgery that will affect them the rest of their life. Now understand that they cannot have any other surgery without a parent's consent. You can't even operate on a child without their legal guardian's consent, except in the most emergency of cases. And yet this nominee for the U.S. Assistant Health Secretary will not confirm whether or not he would allow minors to make that decision and let them be operated on. You know, at least those on the left pushing for abortion into life before there can be any pain. Now, they want to take a child before it can make its own decisions and ruin its life. In the video that I showed you there, Senator Rand Paul even read the testimony of a young girl who went through this and not 5 years later regretted it for the rest of her life. We need to pray for this nation. And I love my church folk. I love the holiness people that I'm around. We're going to have to make a decision to do something. Because what one generation permits, in the next generation it'll prevail. And in the next generation it'll be passed into law. I'm not willing to stand by and let this be an issue for my children and my grandchildren. We live every day with the expectation that Christ is coming back in the clouds of glory to rapture us home to heaven. But we also have to make our prayers and actions as if the sun is going to rise tomorrow. And we have to preserve this world for those who are too young to do it for themselves. If you've not already done it, do me a favor and hit that bell icon so you get notifications every time we get new content on the channel. Hit that subscribe button so you can find us easily. And drop me a comment down below so we can start a conversation. This is Reality Unplugged, praying for America.